Welcome to our webinar, From Patient Progress to Practice Growth, how acupuncture and dry needling can transform not only your patient and client's trajectory, but also yours. I'm Dr. Clarkson. I'm a physiotherapist by background, but I have a master's and a PhD degrees in acupuncture and dry needling. And I've got a full journey to take you on how acupuncture and dry needling can be used as part of your day-to-day practice, but not only as a nice to have, but really why it's absolutely critical that we have these skills as part of what we do to help our patients, our clients. Now, this doesn't matter if you're in the NHS, if you're in a large private organisation, if you're in a small private organisation, you're a sole trader or own your own business. You might even be somebody that isn't even in the health and wellness place and arena. That's fine, right? Because we can talk you through all the different options and different routes. But really, what is the economic argument for acupuncture dry needling? What is the patient's perspective argument? What is the benefit to you? And what is the benefit really to your immediate community? So first and foremost, I would say that one of the biggest draws of acupuncture and dry needling is that you get faster results that are a lot more dramatic. And what we hear often is that people get in touch with us because they're like, look, I'm thinking about doing acupuncture and dry needling. Does it work? All right. And I think that's a fair point. Fair question. We'll always give you an honest answer on this one because although we're big advocates of acupuncture dry needling, we think it's fantastic. It does have some fantastic results. People get super, super huge benefits from their needling skills. It's not for everybody and it doesn't work in all instances. But what I would say is that acupuncture and dry needling will probably more often give you more dramatic results than other interventions that you've got in your toolbox. That's not to say we're getting rid of our other interventions. It's not to say that we should replace everything else that we do with acupuncture and dry needling. It is great. It is fantastic, but it's to be done with other interventions. We do it in combination with other stuff. What we're going to try and do is think about this from multiple angles. So what do patients and clients think about this? Are they actually interested in acupuncture and dry needling, or is this just sort of like some quirk? We're going to take it from an angle of the evidence base. What does research say about acupuncture and dry needling? And then obviously we're going to think about what previous clinicians who've trained with us think about it as well, and who are out there using this day on, day on. I'm going to give you a behind-the-scenes journey of acupuncture. So I'll talk a little bit about my career trajectory, why I got into acupuncture and dry needling. I'm going to give you a traditional Chinese medicine perspective as also a Western perspective. And what I'm going to try to really capture your imagination in is, we can think about using acupuncture and dry needling for a whole swathe of things. It has some fantastic benefits for almost anybody that has symptoms or problems with their health. And we're really confident that if you integrate acupuncture and dry needling into your day-to-day practice, you're going to see benefits from a really, really early point in time. And I'll kind of talk about my personal journey and why I think that is the case. So we'll talk a little bit about what the existing evidence base says on do people want to do this? It's all well and good talking about, and Carl, you're saying it's fantastic, but you're going to say it's fantastic, right? You own Breeze Academy, you teach it, you've got a PhD in it, you're going to say how great it is. Well, in 2012, there was a bit of research that looked at how many acupuncture sessions happen in the UK annually. And in 2012, that was over 4 million appointments. That was 13 years ago, back when acupuncture and dry needling wasn't as available. There wasn't as many people doing it. There wasn't as much of a public awareness about it. Very different nowadays, okay? We have a number of NICE guidelines. So we have NICE guidelines in headache management and in chronic and persistent pain that advocate the use of acupuncture. And we also have guidelines, say, for example, in TMD management. So for dentists and dental pain, the use of acupuncture and dry needling as well. But that 13 years ago, 4 million appointments every year. Google searches every month for the UK alone, 60 100,000 Google searches looking for acupuncture and dry needling. The general public are interested in acupuncture and dry needling. I mean, probably not a massive surprise given that you're here watching a webinar on a bloke talking about acupuncture and dry needling, because you must be like, well, I'm a little bit interested in this. All right. So probably no massive surprise, but to really hit home that this is something that people want. So why? Why are we doing it? What is the benefit of this? Well, first and foremost, it's going to expand yourself. And I'll explain why this is. In any training course that you do, you're obviously going to be better for it, okay? You never go into a learning experience and come out poorer as a result of it, okay? Unless it's been absolutely horrendous. You're always going to come out of learning a new skill, and even if you don't buy into it, and even if you don't get loads from it, you've taken something away from it. And even just the experience of learning something is really helpful. I think you get much more out of acupuncture and dry needling, but at the very, very base layer, you're always going to learn something. When you learn acupuncture, though, and how this is going to really help expand you, is you're going to learn two kind of different takes on this. You're going to learn a traditional Chinese medicine perspective, and you're going to learn a Western perspective. And the reason why these two things are important is that they go lovely together. They marry up, and they really give you, as a clinician, a much deeper, better understanding of the patient as a whole. And I'll explain why. In traditional Chinese medicine, the brain and the body were never split, okay? They were always combined. And so when you think of acupuncture and dry needling as a treatment, it's always holistic, and it's always thinking about the person as a whole. Now, that's what we consider nowadays as contemporary healthcare, right? This is how we should be practicing day to day. And what's lovely is because traditional Chinese medicine, in particular acupuncture, has always been like that, it kind of just comes naturally on how you think about its application. So it really helps you understand the application of acupuncture, but also the application of the body as a whole. And I'm going back, and I remember when I first started learning acupuncture, I remembered what I took from it was going, do you know what? Obviously, the patients that were having acupuncture and dry needling were having some fantastic results, obvs. But more importantly, what I started to notice was my other part of my practice when I wasn't needling, that also improved, that also changed, because acupuncture forces you to think about the whole body picture. It forces you to think about multiple symptoms rather than just one set of symptoms. And because it forces you to think like that, it really drives you to get deeper to understand the client and the patient and really understand, I guess, going in deeper allows you to understand someone better and therefore give them a better service and therefore a better treatment package. So having acupuncture as part of your day-to-day practice, at the very least, is going to make you more appreciative of the person as a whole and how to think about all of their symptoms and how they may intertwine. From the Western perspective, naturally, if you're going to be doing something like acupuncture and dry needling, you have to know about pain physiology. Acupuncture dry needling is used for a load of stuff that isn't included with pain. So hot flushes as an example, overactive bladder as another. But most research looks at acupuncture's impact on pain. And pain is the main reason why people seek out a healthcare professional in the first place. Pain is basically your driver to go and sort something out or stop doing something. So it's probably no surprise that a lot of the research is in pain physiology. And so naturally, if you're going to start using acupuncture and dry needling, you have to get to grips and understand pain and pain physiology perhaps a bit better than what you do now, all right? I mean, you might be fantastic and know it very, very well, but at the very worst, you're going to get it consolidated a lot more often because you're having to think about it all the time as you're applying it. And then the beauty of this, and this is how I teach all of our courses, all of my tutors teach these courses, is that, well, how do you bring traditional Chinese medicine and Western philosophies together? How do you combine these two? Because they're not like one or the other, right? We can combine the two and we get some lush results. Now, as I've kind of hinted at, because of that, you're also going to increase your breadth of treatment options. So the breadth of acupuncture, we needle people in pelvic health. We needle people in persistent and chronic pain. We needle people with migraines. We needle people who are elite performers. So people like Steph Curry and LeBron James. have used acupuncture and dry needling as part of their day-to-day recovery and preparation for the next game. You know, like NBA basketballers have a really incredible high workload, and therefore to recover quicker and be ready for the next game is critical. They're using acupuncture and dry needling all the time. So fantastic breadth of it. And it really doesn't matter what your discipline is, what your area of interest is. You're always going to have people who have other symptoms, right? They're not just going to see you with, I don't know, their osteoarthritic knee pain and then have no other issues. This quote here from one of our previous students, I think, sums this up really nicely. This is from Suzanne. I've been able to help marathon runners to prepare for their event using the 3-leg mile techniques for acupuncture of the knee. Now, the 3-leg mile technique is an acupuncture point in the leg. We actually cover this on our acupressure manual. So in your free 5 acupressure points for every clinician should know, you're going to get this for free, by the way. It's going to come and hit your inbox, so check this out. Check your junk mail in case it's gone into there, but you're going to get that for free. One of the acupuncture points we cover in there for acupressure is this 3-leg mile point that Suzanne's used for marathon runners. I've had amazing feedback from osteoarthritis clients who've had acupuncture for knee pain, and most of all, absolutely amazing results for acupuncture of the lumbar region for back pain. So there were some nice guidelines that came out in 2021 that said that we should be using acupuncture as part of our day-to-day management of chronic and persistent pain patients. We have nice guidelines for migraines, which have said since 2012, we should be using acupuncture as part of a package of care for people who suffer from migraines. So we've got a really strong guideline sense that these things should be included in our practice. Expanding our clientele. So we'll take this from 2 angles, right? We can take it from the NHS perspective. We can take it from the private practitioner's perspective. If you're able to expand your clientele from an NHS perspective, this gives you more options. So if you're kind of early on in your career, or you're a student and you're wanting to learn this before you start to be graduating, you're able to expand the clients, and therefore you're able to provide more value and offer more to your employer because you're able to be diverse. You're able to diversify and move into different areas of practice. When people come into the clinic that you're working in and they have these other conditions, you have something that could potentially help them, so they don't have to be referred on to another service. That skill is really valued, okay? The ability to be able to treat anybody that comes in through the door, perhaps not everybody, but a broader scope of people would go down really, really well. From a private perspective, it's probably obvious, but if you think that as a private practitioner, you've probably got an audience that are around about 3 to 5 mile radius from where your practice is. If you're able to expand that audience from who you currently serve right now, without having to go geographically further, that's fantastic. I mean, just to give you an example, menopausal symptoms react really well to acupuncture, and half of the population are going to go through the menopause. So there you go. From the very, very beginning, you've potentially got half of the population who could now be one of your customers. Also, what you find with acupuncture dry needling is that it probably encourages people to come and see you, because you then become the one-stop shop. You then go to be the person, well, look, you provide all of these lists of interventions, and therefore I'm going to go to you because it seems a comprehensive package. Even if you don't need to needle them, right? They might never need acupuncture and dry needling. It might not be appropriate for them, or they might not request it. The fact that you have it means that people are more likely to go, well, you know, if I ever do need it, I know I can just get it there. I don't have to go somewhere else for it. So that's a powerful kind of attraction for your patients and clients. Zoe, who's another one of our past students. Ever since implementing acupuncture into my practice, I've seen a boost of faster recovery times and happier people with quicker results. I had a client cry because she hasn't felt being pain-free for years. I also had a client who was unable to sleep well, which was also a factor in her symptoms, and auricular acupuncture has now resolved those. The best part is that for clients who haven't had results previously with other treatments, acupuncture has been the first thing that has made a real difference, a real positive difference to their symptoms. So the two things that we often hear, they want to expand their toolkit. They want to add another string to their bow. So people who are coming on our courses, or people who are getting in touch and just saying, like, I just want a bit of information about this. I'm looking to upskill in something, and acupuncture dry needling is one of those things. Well, the big thing I said earlier is about the super fast responses. Within minutes, not for everybody, but within minutes, you can have a dramatic change to symptoms. And I think this is one of the big benefits of acupuncture and dry needling, is that people will often have a tangible change to their symptoms within that first session. Not everybody, and it does take, we say, like, give a minimum of 4 sessions, right? But there are a good group of people who do have positive responses within that first session. Now, if you think about that, that person is more likely to return, they're more likely to refer others, and when the results are quick and longer lasting, they're more likely to buy into you. And if they buy into you, they're more likely to listen to what you've got to say. So your exercise prescription, your advice, your potential lifestyle changes that you're suggesting, all of these things are much more likely to be taken on board because you've given them a super positive experience. We talk about this on some of our courses. It's called the halo effect, and I'd expand more on there. We don't really have the opportunity to do it here now, but that's one of the big reasons why acupuncture and dry needling is so good. I think of it as an enabler. It's not done in isolation. You don't do it by itself. You always do it with other stuff. And really, sometimes I'm not doing acupuncture dry needling. It's not everybody that comes in through the door that gets acupuncture and dry needling. But those that do get it, one of my big reasons for choosing it is thinking, well, I want to be able to do these other interventions, but I need some buy-in. I need this person to kind of believe in me. I need their body to react in a way to say, oh, hold on, this is okay to move, or this is okay to do this strengthening work. And because we're giving somebody a massive positive experience, they're more likely to buy into it. This is perhaps one of my favourite quotes that we've ever had. So Elaine was a senior charge midwife, so she headed up a midwifery department. We have now gone on to set up a service using acupuncture, so a full acupuncture clinic, which is open to all women as part of their pregnancy. Patients have welcomed the weekly clinics, so much so we have had to put on extra clinics in my area. They have reduced the number of hospital admissions due to pain during pregnancy and cut prescriptions for pain relief from GPs. Why I really love this, right, is that it's been so successful that they've set up specific acupuncture clinics. Pregnant women really don't want more medication. They want as least medication as possible, okay? And what they found is that people have needed less medication. They've needed to contact their healthcare professionals less because they don't need the help with their pain management. And they've also reduced the amount of contacts. Traveling is a hassle, right? Like going into the hospital or going to see a GP practice. They're already going to millions of appointments anyway. So reducing that basically benefits everyone, the service, and it benefits the clients as well. The other thing to bear in mind is it's a standout, okay? So if you imagine when somebody's looking for a therapist or they're looking for a clinician, one of the things that they use to define or decide who they're going to go with is the list of services that that person offers. Now, if you are able to offer something that somebody else down the road isn't offering, fantastic. You're not wallpaper. You stand out, right? People will go, there's something different about you, right? They don't know if they want acupuncture and dry needling often, but there's something different about you. You got a more comprehensive package. So that in itself is a fantastic draw. I guess it's probably worth saying, right, that if all of your competitors are offering acupuncture and dry needling and you're not, you're definitely losing out because people will always go to the other people who have got more to offer or more potential to offer things. Coming back to that thing I said earlier about the one-stop shop thing. People just want to go to one person. They don't have to go everywhere. So from a clinical perspective, we can use acupuncture either as an adjunct or as a standalone. I would rarely use acupuncture as a standalone intervention. It's usually done in combination with other stuff. So we can use acupuncture as part of our exercise rehab. We can use it whilst we're giving advice. We can also do it when we're doing other hands-on therapies as well. It's also, I would say probably the second most common thing we hear from people attending our courses are So the first thing is it's another string to me bow, another tool to me toolbox. People want the more interventions. But the second thing we hear most often is it's just saving me hands. It's just saving me thumbs. So they're either already starting to feel the aches and pains or they can see it coming, right? They can see it on the horizon. They're thinking, well, I'm not going to be able to do this forever and I need a way to be able to save me joints. Students who come on our courses, obviously they're thinking way ahead and they're really preserving their bodies. But even the people who are, have been in the game for a while and they're doing a lot of manual therapy, they start to see, actually, I need to be able to do something else to be able to, so that I'm not knackered and I don't need to go and see loads of people all the time to help with my issues. It's not to say that you're replacing what you already do. Far from it. You're still going to do all of the other stuff that you're already doing. You're just adding this in, and it saves you as much as it does your clients and patients. Okay. The other element of this is the economic argument, because I can talk about how fantastic people have found this and how patients love it, and this could be fantastic for your career and all this kind of jazz. But it's like, well, is there a financial argument to this? So we did the research for you. The average initial consultation here in the UK is £85, and the average follow-up charge is £68. So depending on what you charge right now, that might be a considerable uptick to what you're already charging. We've got a table that we can break down all of the costs per region, but as a quick snapshot, London, you're looking at 160 quid for your initial consultation with maybe 130 quid follow-up session. The Northwest, you're looking at 100 quid for an initial consultation, 60 quid for a follow-up. Scotland, seems to be Scotland just kind of got lumped all together. 75 quid for initial, 60 for a follow-up, and then the Northeast. Obviously, why wouldn't you want to come to the Northeast, right? That's where all the best people are. 70 quid for initial consultation and 55 for a follow-up session. So we've done a breakdown there for you on a table. Check it out, guys. But really what we're saying is there are 4 million people, that was back in 2012, 4 million acupuncture sessions that were delivered. There are 60,000 searches for this every single month. It's fair to say that there are people wanting this, and if you're not offering it, somebody else is able to offer it, and you're losing out. Okay, so how do I know all this, right? Well, as I said right at the top, I've got a PhD in acupuncture, so I've done and do research in acupuncture and dry needling. I was an academic for a long time, and I was also a clinician. I actually started out bit like a stereotypical lad from Newcastle, wanted in some way, shape or form to be associated with Newcastle United. I was never, ever, ever going to be good enough to play, that's for sure. But I was attracted to healthcare. I was attracted to helping people, and being a physiotherapist, I thought is a fantastic way to get in there and to be part and parcel of the elite football club that is Newcastle United. So I started out my journey, started out my profession as a physiotherapist, really kind of with that in mind. How am I going to become Newcastle United's physiotherapist? I saw acupuncture and dry needling as a great way to get in there. I saw it as a way of being able to upskill, to make myself look indispensable or certainly stick out from the crowd because I had a skill that other people didn't have. So I would be perhaps higher up the pecking order in a choice. It would then fast track my skill development. What I didn't expect was acupuncture and dry needling to fundamentally change the course of my career. What I started doing was using acupuncture and dry needling in my day-to-day busy MSK practice and found I was getting some absolutely fantastic results. People were coming back and saying, "You have changed my life." They felt that the changes to their symptoms were so significant that they couldn't stop raving about it. And I was like, by the beard of Zeus, what is this thing, right? I wasn't a bad physiotherapist, but I was still fairly new into the profession, still had lots to learn. I felt I was good, but I was okay. I wasn't bad, but I'd never had those kind of responses from people ever before. And so that kind of level of "you've changed my life" was a huge factor in me going, right, I've got to go and figure this out a little bit more. And I think what the telling thing for me that really propelled me and pushed me to go and look into this further to do my master's and PhD was that I was really early on when the big kind of moment that sticks out in my mind was a migraine sufferer, She was on an absolute cocktail of drugs that, we're talking like up to Oromorph that she was on regular to try and manage the symptoms. 3 or 4 sessions of acupuncture. You've changed my life. Paracetamol and ibuprofen every now and then to manage her symptoms. And I think that perhaps the more naive version of me would have went, oh, look at this, I'm fantastic, I'm great. But I kind of very quickly cottoned on to thinking, well, I'd only been doing acupuncture maybe a month, 2 months at this point. So I think I had enough insight to go, do you know what, I can't be fantastic at this. I've only been doing it a really short period of time. Okay, maybe I'm naturally attracted to it and I seem to have a skill associated with this. But to be excellent at something at such an early stage, that's very unlikely. So there's something special about acupuncture and dry needling. There's something that is unique about it. And that was the thing that kind of pushed us on to explore it more. So I did my master's degree in acupuncture. When I did my master's degree in acupuncture, I learned about traditional Chinese medicine and I learned about Western philosophy. And I found that learning both philosophies really helped me to understand how I can combine the two into my day-to-day practice. So I very much work in a Western paradigm, right? As a clinician, I was working in the NHS, I was working in the private sector, and I was working in an environment where we talked about pain physiology and we talked about the body as we know it from an anatomical perspective. The traditional Chinese medicine perspective, though, just gave me some added extra takes on this. As I said earlier, because traditional Chinese medicine has a very much a holistic picture view on things, it really helped to hone my skills to think about people more holistically, more as a combined entity, if you like, and really enhanced my way of thinking. And from that point, that drew us into teaching. So I was a lecturer, senior lecturer, program lead and associate professor at Northumbria University. I was predominantly in physiotherapy, but really what I developed there was a keen interest in education. How do I provide fantastic, cutting-edge education so that people go away from my sessions having a better understanding than they did when they came in? And I think that when I think back to my very, very beginnings of teaching, like I'm thinking about like kind of in-service training, it was awful, right? It was the PowerPoint slides are ram-packed full of information. It was me trying to tell you as much information that I had in my brain. I don't really know what I was trying to do. I mean, I'm certainly not alone in this, and you probably think of educators you've had in the past who are like this, but the education seems to be more about the teacher or the lecturer's opportunity to impress you about how much knowledge they have. Far from it, right? I mean, I've got some fantastic knowledge, right? Fantastic knowledge. But for me, what I learned from that experience and then have taken it into Breeze Academy is education is always about the learner. It's all about the learner and you put the learner first. It would break my heart if somebody left one of my courses going, I don't really know what to do with this, right? I would much, much prefer, and that is our aim, is to make sure people leaving feeling safe, confident, and effective. So if you've got this far, you've heard about the economic argument, you've heard about the people who are using acupuncture day to day, you've heard about the breadth of acupuncture and why patients love it and want it, you're probably starting to think, well, how do I do it? Why us? Why Breeze Academy? Well, why I think we're the training provider of choice. We're the largest acupuncture and dry needling training provider in the UK. We've got over 350 5-star reviews on Google. You can go on there and check them all out. But as I was saying to you earlier, we've really thought about this from the very beginning of like, well, how do I make this an exceptional learning experience? So all of our tutors have gone through the training program with us. So to make sure that no matter who and where you're going for your acupuncture education, you're going to get an exceptional tutor who is super passionate about it. It's just all give, right? And so you come away thinking, right, yeah, I've got this. I feel safe. I feel confident. I know what I'm doing with it. We give you a load of post-course support as well. So as soon as you sign up, right, you get access to the online content immediately, and you get access to my full team. So my full team are trained to know how to direct you to certain educational resources. They can help you kind of guide you on like, you know, how to get to the venue, how to rock up, what time, obviously all that kind of logistical stuff. But then after you've done the course, You get our post-course support in our private Facebook group. So nobody is allowed in there unless they've done an acupuncture course with us at Breeze Academy. And that gives you the confidence that everybody in that forum has done similar training to you and knows the vibe. They know that this is respectful. We know that we can have a bit of fun. We know that there are going to be people there who are going to be super helpful. And all of our tutors are also members in there as well. So if the community are given some suggestions, you might also get one of our tutors, and very often you'll get one of our tutors giving you some advice as well. You have huge cost savings with us because we have got a fantastic online platform. I'm not talking about, grainy videos that have been shot in a live environment. I'm talking about purpose-made online content to make the learning easier, to take theoretical components, break them down so you can pause, rewind and replay at your heart's content. You've got 6 months access to all of this online content, right? So you can just keep on going back and back and back all the time. And it just means that you hit the ground running when it comes to an intense practical workshop. And the reason why that saves you money is because, well, what other course providers will have to do is they'll have to deliver that face-to-face. And if they have got an online component, perhaps they haven't got it as good as what we would have. I'm going to say that, right? I mean, it's no disrespect to other people, but I'm going to say that we're the best, right? You'd like to think that. So that's one way of saving you money, because you're not having to go to more days face-to-face, which costs you in terms of annual leave. It costs you in terms of time and money for like parking, travel, food, all that kind of stuff. The other thing it will help you with is that this is a dual qualification. So you get acupuncture and dry needling with our foundation course. It's different with our entry-level course, but with our foundation course, it's acupuncture and dry needling. So you don't have to go and do 2 separate courses. You can do both with us and you get both in the one course. As I've already said, it's curated with you as the learner at heart of everything that we do, so you know that, right, this feels like it's been tailored to me, to my practice, to the clients that I see. And, all of our tutors are well versed in that approach. We've got a huge diverse in what people do. You'll have a fantastic time, I promise you. So how do we do it? I'm going to broadly talk about this in 3 arenas. You've got the group who are regulated healthcare professionals, sports rehabbers, sports therapists, or level 4 sports massage therapists. For you guys, it's the acupuncture and dry needling foundation course. If you're a health and wellness practitioner, you guys head to the entry-level acupuncture course. You can then subsequently go on to do the foundation acupuncture dry needling, but you have to start at the entry-level course. And for those of you that aren't a practicing healthcare professional at the minute, or you are in kind of the health and wellness realm, but it's not a hands-on therapy, or you don't have a level 3 anatomy as part of the qualification, we've also got 2 routes for you as well, which I'll explain in a minute. So let's reverse back and let's go to the regulated healthcare professionals, sports rehabbers, therapists, and level 4 sports massage therapists. You guys do the foundation acupuncture dry needling course. On the foundation acupuncture dry needling course, you're basically going to learn the fundamentals, tools of the trade. So you're going to learn about where to position yourself, where to position your client, which end you stick the needle into, how you find the acupuncture points, how you stick the needle in, how far, what you do with the needle when you get it there. And then we kind of culminate right at the end of the day to do some case study work and some clinical reasoning to really, really hone in and think about, well, how do we decide which acupuncture points to choose and tailor it to somebody coming into our clinic? That's day 1. Day 2, we dive deep into some more advanced needling techniques. So these advanced needling techniques are stuff that has been practiced in traditional Chinese medicine for thousands of years, and it's also supported by the evidence base. It gets you more out of your acupuncture practice. You're needling all the limbs. You'll be needling the thorax and the trunk, which carries a bit more danger to it. So there's some very specific safety lessons that are derived around that. And you'll be doing some pain physiology stuff as well. The pain physiology really gives you a really good understanding of, well, why am I using acupuncture dry needling? When will I use acupuncture and dry needling? How do I combine this with other interventions? I said this earlier, right? That acupuncture and dry needling, it isn't a standalone intervention. It's done with other stuff. And so we do this on day 2 to make you think, right, well, how am I going to add this into everything else that I'm doing? And then day 3, more case studies, more spinal needling, some ear stuff, some facial stuff, some deep needling from a dry needling perspective as well. And by the end of that 3rd day, you're leaving safe, confident, and effective. For those of you that are the health and wellness practitioners, so you've got a level 3 anatomy qualification as part of that, and it's a hands-on therapy that you're doing, you guys can go straight to the entry-level acupuncture course. Now, that doesn't cover any needling over the torso, and it doesn't have clinical reasoning as the guiding thread. What the entry-level course focuses on is more health and wellness protocols. So if I was going to say menopause as a good example and all of the different signs and symptoms that somebody who's going through the menopause has, that's a great way to think about it, okay? Because the protocols that we give are like, well, if somebody has these symptoms, use these acupuncture points. So there's set protocols that you do. Sometimes we call them recipes. So you do these set points for these set symptoms and conditions. If you then decide that you want to go on further, then we have a route for you to the Foundation Acupuncture and Dry Needling course via something called the Bridging course. We're going to explain that more to you if you're interested. And then finally, if you're either in the health and wellness realm but don't have that formal qualification, or you're just looking for a change of career, you're like, look, I really want to get into being able to help people and I feel that acupuncture really connects with me, then we've got 2 routes for you. We've got the reflexology route, where you become a qualified reflexologist first. And then once you become a qualified reflexologist, you can then do our entry-level acupuncture course. Or what you can do is our sports massage qualifications. So if you think you're going to be working more with injuries and pain, you maybe go down the more sports massage route, where, again, you would get qualifications in sports massage, and then you'll be able to then go on and do your acupuncture qualifications. You know, there are other routes that you can do this. So you can go and do a formal acupuncture degree. A degree is usually full-time. It normally costs a lot more, and it tends to take about 2 or 3 years. So through us giving you other qualifications, either as a reflexologist or a sports massage therapist, it really helps you to be able to do it a bit quicker and quite a bit cheaper as well. All right, guys. So I've covered loads here in this webinar, and really what I'm hoping that you've got from this is, right, I understand the economic argument. I understand that there is a compelling patient perspective argument on this. And I understand that from my own personal growth journey, whether it be from me CPD-wise or for my business, acupuncture and dry needling makes sense. You've got your free 5 acupressure points every clinician must know. You've got that for free, okay? You can put this into practice within 10 minutes. It's not like reading like a massive book and it's going to take you hours and hours and hours. Within 10 minutes, you can be doing this and with your clients and patients right away, okay? So you're going to get that for free. But if you're interested and you said, you know what? I know that acupuncture dry needling is something I want to do. You've got a couple of options, right? You'll see the link below. Book a call. You can speak to either myself or one of my team. Very well versed in what options you've got. Really get to know you, what you're trying to look for, trying to figure out, is acupuncture and dry needling for you? Because it might not be, right? We might get on that call with you and say, you know what? This doesn't sound like it's the right time for you, or you might be better suited to go elsewhere and do training in this and that or the other. So a lot about that call can be to just help you kind of finalize, is this for me, and which route is my best route? If you don't want to do the call and you'd rather do it by text and email, there's a link there below where you can send us a contact form in, and one of my team will be in contact straight away to get in touch. Or if you're like, right, that's what I needed. I know I need to include acupuncture dry needling in my day-to-day practice. You just head to our website, you select the event, so the location and the dates that you like. You click on book now. You can either do paying up front or you're paying installments. Doesn't really matter which one you go with. And you can get booked on straight away. As soon as you book on, you get an email from us with the link to the online work so you can get started straight away. I hope you found that helpful. Don't forget about your acupressure guide. I'd love to hear from you and hear what you've got to say. If you want to know a little bit more, if you want to know a bit more in depth, we have a podcast that we release a new episode every week. And we're always putting stuff up on social media. But it would be great to hear from you direct. So give us a call, drop us an email, or just book on straight away. Thanks.